All right, today we're putting on our detective hats to investigate a pretty common medical mystery, the case of the missing period. Let's break down exactly how doctors crack this one.
So you're expecting your period, you're watching the calendar, and then nothing. The days start to tick by, maybe they turn into weeks or even months, and that can bring up a lot of questions. So really, where did it go? Let's start with what the doctors actually call this.
The official medical term is amenorrhea. Now, it's really important to get this straight right away. Amenorrhea isn't a disease in itself. Think of it more like a symptom. It's a signal, a clue from your body that something else is going on under the hood. It's our first lead in the case.
And that's exactly why this is a case worth investigating. You know, a lot of experts think of the menstrual cycle as a fifth vital sign, right up there with your heart rate or your blood pressure. So when it suddenly vanishes, your body is sending you a message, and it's one we should definitely pay attention to.
Every good investigation starts by sorting the evidence. When it comes to amenorrhea, that means figuring out which of two main types of cases we're actually dealing with. So on one hand, you have primary amenorrhea. This is when someone hasn't had their very first period by age 16. On the other hand, and this is much more common, you have secondary amenorrhea. This is when you've been having periods and then they just stop for 6 months or more. We're going to focus our investigation on the secondary type just because the list of potential causes is so much broader.
And just to give you some quick context, while the average age for a first period in a place like the Netherlands is around 13, that medical cutoff is age 16. That's really the benchmark doctors use before they start investigating primary amenorrhea.
Okay, now for the fun part, the real detective work. With secondary amenorrhea, it's time to line up the usual suspects, all the potential culprits that could be behind that missing period.
Our investigation is going to cover 5 key areas. We're going to look for clues right at the source, in the uterus and ovaries. Then we'll check the brain's hormonal command center, and also consider things like medication and what we call functional causes.
Let's start with the most obvious suspect of all, right there at the uterine level, pregnancy. I mean, it is the most common reason for a missed period. Full stop. But we'd also look at things like scarring in the uterus. Then, at the ovarian level, 2 major suspects pop up. One is premature ovarian insufficiency, which is basically early menopause, and the other is a really common condition you've probably heard of called polycystic ovary syndrome, or PCOS.
Now, diagnosing PCOS is pretty interesting because it's not based on just one single test. Instead, a doctor is looking for a pattern, a collection of clues. You actually need to have at least 2 of these 3 things for a diagnosis: infrequent periods, physical signs of high androgens like acne or excess hair growth, and then seeing polycystic ovaries on an ultrasound.
And PCOS is a really major suspect in these cases. It's estimated to affect about 6% of women in their reproductive years, which makes it a very common reason for secondary amenorrhea.
Okay, moving on. Sometimes the issue isn't in the ovaries or uterus, but in the brain's command center. Things like thyroid problems or a prolactin-producing tumor can throw everything off. Certain medications can also be a factor, and while, it can definitely take a few months for your cycle to get back to normal after stopping birth control, this idea of long-term post-pill amenorrhea is actually considered pretty unlikely by most doctors.
Now, this brings us to a really important category called functional amenorrhea. The key thing to understand here is that this is not caused by a disease. It's actually your body's adaptive response to a huge amount of stress. It's your body basically saying, whoa, we have way too much going on right now, so we're going to shut down this non-essential system, reproduction, to save energy. It's an adaptation.
So what kind of stressors are we talking about? Well, it could be major psychological stress, really intense physical training, or rapid weight loss and nutritional issues. Any of these can basically send a signal to the brain to hit the pause button on menstruation. It's a physiological survival mechanism.
So, we've lined up all the suspects, but how does a doctor actually solve the case? Well, let's take a look at the detective's toolkit they use for the diagnostic journey.
The process usually follows 3 classic steps. It always starts with the interview, or what doctors call anamnesis. That's where they get your whole story. Next up is the physical exam, which is like examining the scene of the crime for physical clues. And finally, if needed, they call in the forensics, further tests like blood work or an ultrasound.
And honestly, that interview is probably the most important part of the whole investigation. Your answers provide the biggest clues. A doctor will ask about everything: your period history, any medications, and those key lifestyle factors like stress, diet, and exercise.
Any other symptoms you're having are also vital pieces of the puzzle.
Now, if more evidence is needed, these are the typical next steps. A pregnancy test is always step one. Blood tests can then check on how the ovaries are doing. Check pituitary gland function with prolactin levels, and check the thyroid. And finally, an ultrasound gives the doctor a direct look at the uterus and ovaries to spot clues for conditions like PCOS.
And here's an interesting little update from the field. There's an older test called the progesterone challenge that you might have heard of. Well, it's actually not recommended in primary care anymore. The clinical guidelines have evolved, and experts found it just doesn't provide enough useful diagnostic info. It's a great example of how medicine is always moving forward.
So, once the cause has been identified, the case isn't quite closed. The final chapter is all about management, figuring out what happens next now that we finally have an answer.
But before we dive into specifics, there's some advice that's true no matter what the diagnosis is. First, and this is a big one, a missing period does not automatically mean you're infertile. Ovulation can still happen, sometimes out of the blue. That means you should always use contraception if you don't want to get pregnant. And of course, the right management plan has to be tailored to the specific cause.
As you can see here, the game plan totally depends on the cause. For functional amenorrhea, it's all about tackling that underlying stressor. For PCS, lifestyle changes are absolutely key, maybe with some medication. And for those cases of primary amenorrhea, that almost always means a referral to a specialist for a much deeper investigation.
I really want to end on this point because it's such a reassuring one for what is one of the most common causes. For functional amenorrhea, once that underlying stressor is managed, experience shows us that the body is incredibly resilient. The menstrual cycle almost always comes back all on its own.
So, I think the ultimate takeaway from this whole investigation is this. A missing period isn't necessarily a crisis, but it is always a message. The real key to solving this mystery is just learning how to listen to what your body is trying to tell you. Thanks for listening.